Welcome to Sam Interviews. I'm your host, Sam Alcantara, and today we'll be discussing about virtual healthcare. Joining me are Dr. Layutan, a telemedicine expert, Nurse Jake, who works in virtual care, and Mark Santos, a patient who uses wearables to track his health. Dr. Tan, let's start with you. We have virtual classrooms, virtual meetings, but what exactly is virtual healthcare? Virtual healthcare are medical services that are rendered through video calls, mobile apps, and online platforms. So for example, I have a patient who has a rash and wants to get it checked. Instead of personally going to my clinic, he can send a picture through an app. Finally, I can send my prescription over the phone too, so he can just show it to the pharmacy. Wow, sounds convenient. No need for the patient to travel, and no need to go through long waiting lines. Yes, and if I may add, that was particularly helpful during the pandemic. Yeah, because of the social protocols where we have to limit face-to-face interactions. True enough, there's even a remote operation wherein a surgeon in New York removed a gallbladder of a patient in France. That's a remarkable use of technology. How about you, Nurse Jake? What's it like working in virtual care? So I'm based here in the Philippines, but my patient is in a hospital in New York. But we can see each other through a movable TEMI robot that goes around the room. To assess her symptoms and monitor her condition, we can schedule a Zoom meeting. The robot also has equipment for vital signs and ECG. There is a voice prompt from the robot providing instructions like place the stethoscope on the chest so nurses nearby can carry it out. Whoa, that sounds futuristic. But going back to the pandemic issue, this seems to be a safe way to minimize the risk of transmission, right? Correct. It protects both the patients and healthcare workers from hospital-acquired diseases. Let's say the patient is immunocompromised. As a virtual nurse, even if I have cough or colds, I can still perform my nursing tasks without jeopardizing the patient's health. Nice! Now Mark, as a patient using wearables, how has it changed your experience? It's really helpful. My doctor sees my data through an app, so I don't need to go to the clinic as much. As a hypertensive, I'm more aware of my health, since my smartwatch tracks both blood pressure and heart rate. So, if I ever get a heart attack, God forbid, my doctor will see it and get me treated as soon as possible. That's great! It could be a lifesaver, but do you have any concerns? Yes, sometimes the readings aren't accurate and privacy is a big issue for me. I worry about who has access to my health data. That brings us to the big question. Is virtual healthcare better than traditional care? Dr. Tan, what do you think? Virtual healthcare offers both accessibility and convenience, especially for chronic disease management or follow-ups. Even mental health therapy sessions can be done online. But traditional care is still needed for physical exams, emergencies, and lab tests. So, in my opinion, they should work together, not compete. Nurse Jake, do you agree? Yes, virtual care helps us reach more people. Not only those abroad can benefit, but even those in hard-to-reach rural areas in the Philippines. However, if they have poor internet or find technology confusing, that will be another problem, I guess. Though, in general, seeing the patients face-to-face still matter for accurate assessment. Yeah, because robots can perform physical functions like a traditional nurse, right? Yeah, in our case, robots cannot perform tasks that require precision, such as IV insertion and catheterization. The camera of the robot only provides limited view too. Unlike when you are present in the bedside, you can see everything you want to see, not just the 2D view which the camera offers. Let's say the patient has a bed sore and is unable to move. To assess that wound, you must have someone to turn the patient to her side. Right, that makes sense. What about you as a patient, Mark? I like virtual checkups for regular monitoring, but if I feel something serious, I still prefer going to the clinic or hospital. For me, it's about balance and knowing what each is appropriate. Well said, everyone. Thanks to our guests, Dr. Tan, Nurse Jake, and Mark. After all, people must remain at the center of healthcare. I am Sam Alcantara, and this has been Sam Interviews. Stay safe and stay healthy.